February is Women's Heart Health Month, and we're helping raise awareness by going red. We learned how women can take action. I'm joined by two-time stroke survivor Ashley Harris and Esther Kwan, the CEO of Methodist Hospital Texan. Welcome, ladies. Thank you for being with us today. Esther, why does the American Heart Association work with such intention to specifically focus on women's heart health?
Yes, heart disease is actually the #1 killer of women aged 20 and up, and it's something that is actually largely preventable with lifestyle changes and active healthcare choices. Women can choose to prevent heart disease. The American Heart Association actually empowers women with education and resources to be active individuals in determining their health outcomes.
It is alarming to hear as a woman, what you just said. So it's important to bring this information to light to our audience. And Ashley, as a two-time stroke survivor, you have a story and a message you want to share with our ladies in the audience.
That's right. I was actually out with my husband on President's Day in 2011, and I just started feeling disoriented and just off is the only way to describe it. And, as nearly every woman does, ignore it and it will go away. But I ignored it and it did not go away. And I wound up at the doctor the next day, and she sent me to have a scan done, and they said, well, it's perfectly normal for a 36-year-old woman to have a 7-millimeter lesion on her brain, which it is not. I spent the next 6 months going from doctor to doctor trying to find out what was going on, and then I finally wound up at a heart doctor, and he told me I had had a stroke. And as a woman, as a mother of 2 children, that's extremely hard to hear. And so my message this year to every woman is take care of yourself, because the most important thing that we can do as mothers and daughters and sisters is to take care of ourselves, because who will be here to take care of our family, not if, but when something happens. I think the thing that has always stuck with me over the years is that I knew that stroke symptoms present differently in men than in women. And so I knew what to be on the lookout for. It's so much easier to ignore it than it is to actually do something about it. And the sooner you get treated, the sooner that you see a doctor, the better off your outcome is going to be.
And so what are some steps that women can take? You were talking about prevention or just awareness. I mean, listening to your symptoms, I'm already like, okay, if I ever feel that, I'm absolutely going to the hospital, right? Because I wouldn't know how to gauge that.
Yeah, I couldn't have said it better than Ashley did. It's knowing your body, understanding it from a symptom perspective, but also your numbers. And so getting help, engaging with amazing physicians, and I know we have a number of them across San Antonio that can help partner in your care and be a resource for you. And then just everyday things like healthy diet, exercise, taking the stairs if you have an option, and just making good life decisions so that you can live a healthy life.
And Esther, how can people stay in touch with you guys? Do they need to, if they want to book an appointment, how can they go about doing that?
Absolutely. You can actually visit Methodist Healthcare's website, and you can go to Find a Doc and identify a doctor that lives in close proximity or for the specialty that you're needing help with.
Well, thank you both for being with us today.
Thank you for having us today.
Thank you.